Do you have spine symptoms and been told that you have stenosis? Either a doctor has told you or you've seen that phrase on your imaging report, such as an MRI, CT scan, or X-ray? Do you wonder what stenosis is? Well, don't worry, you're not alone. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, and I'm fellowship trained in primary spine care. We've been treating patients for decades, and many of them with the diagnosis of stenosis. Please remember these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's discuss what this is. Stenosis is basically constriction of a hole, a channel, or a passageway where some sort of living tissue needs to flow through it. The most common type of stenosis that we see on imaging is hard stenosis. That's stenosis that's from arthritis. It's been there for a long period of time. It has slowly grown in and occluded or constricted the canal. However, following trauma such as a motor vehicle crash or a slip and fall or a work injury, you can have soft stenosis, and that's usually from an injured disc that has now herniated and is pushing into the canal, and the soft stenosis is now constricting the passageway where the nerve comes out. So I've got some models here. I'm going to show you hard stenosis. So first, this is a sample piece of lower back. This is a plastic model, and you can see these bumps right here. These are the bumps that you feel on your neck and on your back. Okay, this right here is the spinal cord, and then this is the nerve roots that exit out. And you can see the hole where the nerve comes out. You can see how there is space around there. As time goes on, if that nerve has a soft occlusion or a soft constriction, you can see how this nerve right here, there's not much space there compared to the other model. This one right here, there's no soft disc herniation. You can just see how there's all this spondylosis, which is another video that we did, by the way. You can see all of this hooking in the spurs. You can see the spurs back here and how there's no space around that nerve. You can even see how that nerve looks smaller than we did in the earlier model. So the symptoms that you can get from a true pinched nerve from stenosis is you can have numbness, pain, and weakness, and it all depends. And where will it go? Well, it all depends on where the stenosis is at and where the constriction is at. If it's in the spinal cord itself, that's what goes down through the center of the spinal column, you can get symptoms that are called myelopathic. Those are very concerning, and you need to make sure that your doctor is able to identify that. More commonly, we see it where the nerves branch out and exit from the spine. That is usually in an area called the foramen. Where the nerves exit out right here, that's called the foramen. Where the spinal cord is going down the center, that's called the central canal. And when you have symptoms at the foramen from nerve compression, you can get numbness and weakness down that entire nerve. So oftentimes the nerve will serve as different reflexes in the limb, be it the upper limb or lower limb. Those reflexes can be impacted. Muscles, different muscles are innervated by different nerves. Sometimes we can see muscle weakness. And then the nerves also go to different areas on the skin. So the skin is serviced by nerves. And when that nerve is compromised, compressed, and not functioning correctly, we can see altered skin sensation. And they're in a pretty common distribution throughout the skin. So we can kind of isolate down to where it's at. So can chiropractic care help with this? The answer to that is a yes and no. You have to be careful what type of chiropractor that you see. You have to be careful what type of treatment that you see. But for the most part, as long as you have a qualified chiropractor that knows how to manage stenosis and knows how to manage whether it's foraminal or whether it's in the central canal, depending on the location and the severity, there are things that chiropractors can do to help reduce and relieve the symptoms. If it's a soft stenosis, such as from a disc herniation, it's understandable to realize this, but the prognosis is a lot better. If it's hard, due to arthritis that's been there for a while, prognosis is not as good. However, we still try to help patients recover to the greatest extent possible. Thank you so much for watching this video. I hope that you found it helpful. You have many videos to pick from, and I'm honored that you chose this one. And until we meet again, have a blessed day.